Did you know that a simple stomach bug can put a diabetic in the hospital on dialysis within 5 hours? Not a car accident. Not a heart attack. Vomiting. That's it. Most people think dehydration just means a headache and a dry mouth, something you shrug off with a glass of water and a nap. But if you have diabetes, that assumption can be the most dangerous thing you believe. In the next few minutes, I'm going to walk you through exactly why dehydration turns into a runaway train for diabetics, the warning signs your body gives you before things spiral, and the one habit that separates people who ride out a bad stomach bug from people who end up in an emergency room. Let's start with the vicious circle, because once you understand this, you'll never look at a simple stomach bug the same way again. Here's what most people assume. You get sick, you lose some fluids, you drink some water, you're fine in a day or two. For a non-diabetic, that's often true. But researchers who study diabetic emergencies point to something most people never learn. Dehydration and blood sugar are locked in a feedback loop, and for a diabetic, that loop can spin out of control in a matter of hours, not days. Here's the mechanism. When you're sick with an infection, even something as small as a stomach virus, your blood sugar tends to rise, because infection itself is a stressor that pushes glucose up. Now add vomiting or diarrhea. You're losing fluid from your gut, and your body pulls replacement fluid from the largest reservoir it has, your bloodstream. But here's the catch: when water moves out of your blood, the sugar in that blood doesn't move with it. It stays behind, concentrated. Your blood sugar climbs even higher. At the same time, your blood vessels form a network that narrows as it spreads from your core out to your extremities. When your bloodstream loses volume, those narrow outer vessels are the first to be shortchanged. Less blood and less insulin and glucose reaches the cells out there. It functions almost like a sudden new layer of insulin resistance, even if your insulin dose hasn't changed at all. And the higher your blood sugar climbs, the more insulin resistant you become. It feeds itself. Then your kidneys step in to try to flush out the excess sugar, which means more urination, which means more fluid loss, which means more dehydration, which pushes your blood sugar even higher. Round and round it goes. And if it goes far enough, your cells, starved of the glucose and insulin they need, start burning fat for fuel instead. That process creates ketones, which your kidneys also try to flush out through urine, deepening the dehydration even further. This isn't a slow decline over a week. This chain of events can unfold in a matter of hours. So how do you know if this is happening to you? A few signs to watch for. Your blood sugar readings climbing even though you haven't eaten, unusual thirst that doesn't quit no matter how much you drink, a dry mouth that water doesn't seem to fix, and if things have progressed further, nausea, confusion, or unusually deep, labored breathing. Any one of these during a bout of vomiting, diarrhea, or fever is your body telling you the cycle has already started. Now here's the part almost nobody hears clearly enough. This cycle can lead to two genuinely life-threatening conditions. The first is diabetic ketoacidosis, or DKA, a buildup of toxic ketones in the blood, most common in people whose bodies make little or no insulin of their own. The second is something called a hyperosmolar state, where blood sugar climbs to extreme levels, in documented cases, over 10 times a normal reading, while the blood becomes dangerously concentrated from lack of water. This second condition is sneakier, because it often shows up in people who still make some insulin, and it tends to hit older adults hardest, partly because the usual warning sign of intense thirst is often blunted with age. Left untreated, both conditions can progress to confusion, loss of consciousness, and death. That's not fear-mongering. That's the documented physiology of why a stomach bug is not just a stomach bug when you have diabetes. So, what actually breaks this cycle? Fluid and, when appropriate, insulin administered and monitored by a medical professional who can see your actual blood sugar and ketone levels in real time. This is not a situation for guesswork, home remedies, or waiting it out to see if you feel better tomorrow. If you are vomiting, have diarrhea, are running a fever, or notice a stretch of unexplained high blood sugars, the single most protective thing you can do is call your physician immediately, even if it's 2 a.m. Even if it feels like an overreaction, even if you're worried about seeming dramatic. Doctors who treat diabetics will tell you they'd much rather get that call early, while the situation is still simple to manage, then get the call 5 hours later when someone is already in kidney failure. Here's a habit worth building into your routine before you're ever sick. Know your baseline plan. Talk to your doctor now, while you're healthy, about exactly what they want you to do the moment a dehydrating illness starts, what to watch for, when to test for ketones, and at what point they want you heading to urgent care instead of waiting at home. Having that conversation in advance means that when you're nauseous and miserable at 2 a.m, you're not trying to make complicated medical decisions on the fly. You're just following a plan your doctor already helped you build. And if you live with a diabetic or you're one, treat any bloody stool, high fever, or confusion as a same-day emergency room situation, not a wait-and-see one. Those symptoms mean the body may already be past the point where fluids and rest can fix things on their own. There's also a version of this danger that's easy to miss entirely because it doesn't come with vomiting or diarrhea at all. Infections that sit quietly in the body, a tooth root, an infected gum, even a hidden urinary tract infection, can push blood sugar up for weeks without an obvious symptom pointing you toward the cause. If your blood sugar has crept up and stayed up for no clear reason, and nothing about your routine has changed, that's worth a call to your doctor too. Sometimes the fix isn't more insulin, it's finding and treating an infection that's been quietly driving the numbers up in the background. Dental infections in particular are one of the most overlooked triggers because the pain can be mild or even absent, especially in a tooth root or the jawbone itself. It's also worth knowing what not to reach for on your own during a dehydrating illness. Certain everyday medications, including some blood pressure drugs and common anti-inflammatory painkillers, can make dehydration and kidney strain worse when your body is already struggling to hold onto fluid. This is exactly why the call to your doctor matters so much. They can tell you, based on what you're already taking, what's safe to continue and what needs to pause until you're better. This isn't a decision to make by guessing or by searching your symptoms online at midnight. If there's one thing to take from this video, it's that dehydration for a diabetic is not a minor inconvenience. It's a cascading chain reaction, and the earlier you interrupt it, the easier it is to stop. Most of the people who end up hospitalized for this didn't ignore the danger because they were careless. They simply didn't know the mechanism, so they didn't recognize how fast things could turn. Now you do. If you found this useful and you want to understand more about how the everyday mechanics of your body actually work, the stuff that doesn't always make it into a 10-minute doctor's appointment, hit subscribe. Because that's exactly what this channel is built around, giving you the real mechanism behind the advice, so you know not just what to do, but why it matters. Stay hydrated, know your plan, and don't wait to make the call.